Hi everybody, good afternoon and welcome to the George Institute for Global Health UK at the University of Oxford. My name is Jackie Webster and I'm Head of Advocacy and Policy Impact at the George Institute for Global Health based in Sydney. I'm also the academic lead on the George Institute's Thought Leadership Programme, which aims to challenge the status quo by fostering debates that deliver new insight with a view to influencing policy and practice. And we've got a leaflet about the Thought Leadership Programme on your seats today. So before I start, I just have to deal with the practical issues today. So we haven't got any fire alarms scheduled. So if the fire alarm does go off, follow the fire exit signs, and likewise the bathrooms are just out there. If you go out these doors and turn right, or these doors and turn left and left. And we will be serving drinks and nibbles after the event, so we hope you'll join us for drinks and nibbles. Sorry, Corinna, moving your slides. The George Institute is a global health research organisation focusing on non-communicable diseases and injury. Our headquarters are in Sydney and we have offices in China and India as well as here in the UK. The UK office, which is privileged to be part of the University of Oxford, is our smallest office with just 300 staff members, and that's out of a total of around 800 members worldwide now. But the office here is already growing and has influence, and that's partly due to our excellent network of collaborators, many of you who are here today. So today's event is on creating healthy, sustainable food environments. And this is a key priority for people and governments throughout the world. I'm delighted that Professor Corinna Hawkes is here with us, and we've got an outstanding panel of speakers. I first met Corinna more than 20 years ago when we worked together at Sustain, the Alliance for Better Food and Farming, on a report called Waste Not, Want Not, Debates on Surplus Food Redistribution. So this report challenged the basis of food banks and food redistribution schemes, and argued that we should be focusing our efforts on tackling systemic issues such as poverty and the sort of environmentally unfriendly food environment that was leading to food waste. So 20 years on, and it's kind of a little bit sad to report that I think things have got worse and not better. When I came to Oxford on Wednesday evening and had a wander around the streets at 9 p.m, excited to go and sort of revisit the beautiful colleges and be inspired by the spires, I was instead shocked and depressed by the amount of homeless people I saw in the streets and begging for food. And this is in a city where both wealth and food are in abundance, and we have some of the cleverest, most influential people in the world. So it's hard to understand how this can happen. But it's not just in the UK. We're seeing the same patterns in Sydney with increasing numbers of homeless people year on year. And just 3 days ago, the Premier of New South Wales announced free breakfast clubs in 500 schools across New South Wales to address food poverty. The breakfast clubs are going to be run in partnership with Food Bank Australia, which is Australia's largest charity relief programme. So I'm really glad that these kids are going to be getting a free breakfast, but I'm depressed that so many children in Australia need to rely on food banks. At the George Institute, our work on food policy has been directed very much towards changing the food environment. So we've had a big focus on food reformulation, monitoring nutrition content of the food supply, and front-of-pack labelling. And as director of the World Health Organization Collaborating Centre on Salt Reduction, much of my own work has been focused on targets for food reformulation. The George Institute's Food Switch app is now in all 4 countries that we have offices in, so it's in Australia, China, India, as well as the UK, and in a bunch of other countries. These initiatives are really important, and I've no doubt, in fact, that actually reducing salt levels in foods is going to be one of the most cost-effective interventions for reducing disease burden. But I'm increasingly asking myself what more we should be doing to address the shift the balance of diets towards less processed foods? How can we transform food environments so that healthier, more sustainable foods are actually the norm? So that's why I'm looking forward to this event today. The main question we're asking is how can researchers, city leaders, businesses and advocates work together to deliver a healthier urban food environment? You have the agendas and speakers' biographies on your chair, so I won't go into those. Without further ado, I'm delighted to introduce Professor Corinna Hawkes. She's Director of the Centre for Food Policy at City University and a leading expert on food systems thinking. So thank you, Corinna.
I'm just going to go back to the title there.
Sorry.
No, that's okay. I think I'm going in the wrong direction still, aren't I? Yeah, I've got it. Okay. Thanks, Jackie. Really nice to be here and really privileged to be a distinguished fellow with the George Institute for Global Health. Really delighted and honoured. And so the event tonight is meant to kind of try and explore some ideas and thinking about how we can really fundamentally change food environments. As Jackie said, I've been working in this area for 20 years now, since the first project I ever did on food was with Jackie, so it was 20 years. And it can be a bit depressing that things haven't changed fast enough, even though, well, fast at all, even though there's been a lot of progress that has been made over the years. So what I've been trying to think of in the last year or so is really kind of how can we really get to grips with this, and what is it really going to take to change food environments? And I'm very fortunate to develop an interest in city-level approaches. I was fortunate to be appointed to the London Food Board and now the Vice Chair of the London Child Obesity Taskforce, which has been both of them really fantastic learning experiences for me. And I've also done some work looking at what other cities have done around the world and got really excited. Like when you see change happening and things happening, you kind of want to go towards that and say, right, what can I learn from this? What can we build on where we see these kind of locuses of action? So I see cities as a really exciting place to be working right now. So that's why I'm focusing on cities. So the first question is, if we're talking about food environments, that's what is around us when we go about in our everyday lives, the food that's around us, how much it costs, how it's marketed to us, what we see. What do urban food environments look like now? Well, to some extent, you'd say, well, what is the problem? I mean, it's exciting. Urban food environments are amazing. You go to leading world cities and you've got fantastic healthy food on the streets. You can go down the road to Waitrose here in Oxford. We keep on reading about it in the newspapers about the new Oxford Waitrose with a refill station. And look, you can get all of these fresh fruits and vegetables. You can get great healthy food from food service operators. And when you think about how this amazingly healthy food has got onto cities through boats, through trains, through planes, it's extraordinary what our urban food environments look like. And actually, when you look at the history of cities, one of the earliest preoccupations of the Greeks and so on was how do we get food into cities? And when you think about the remarkable amount that has been achieved, we shouldn't underestimate that. But that's actually not really what we're talking about. We're talking about this. We're talking about the fact that there are so many parts of cities that are characterised by unhealthy food environments. And it tends to be associated with situations of deprivation. That's not entirely the case. There's lots and lots of unhealthy food environments for everyone, but the situation tends to be most unbalanced in situations of deprivation. These are pictures from cities around the world. There's a girl eating snack foods in Peru, which is just a picture outside of her school. There's a Lidl selling biscuits for, actually the sign at the top I think was more like 22 pence in Stoke-on-Trent, where one of my colleagues is working. I was in Chile in January looking at the incredible label that they have there on unhealthy foods, but also the incredibly large amount of unhealthy foods. And then street food in a range of African nations can be extremely unhealthy, as in other nations as well, and all over the world. And the other picture at the bottom is where my father-in-law lives, where my husband's from, which is the Toxteth area of Liverpool, where there kind of isn't really anything. at all. My local supermarket there on the bottom right, where I go to on a regular basis to take photos to prove that they are still not taking that chocolate out of the front and charging half price for it. This is Great Yarmouth on the top right, which is an advertising near a place popular with children. Mexico, Florida. These are places around the world which really show that we have a lot of work to do on our food environments. So then what would it look like if it was a really healthy, wonderful food environment? In my view, it would look like this. It would look like the plate that we are meant to eat. That is good for our health. So this is from the Lancet Commission. Some of you may have come across the Lancet report, which produced a plate of food that would support good health and sustainability. But food-based dietary guidelines are around in many parts of the world, and the most innovative one has just come out in Canada recently. So it doesn't have to be this. It could be another food-based dietary guideline. But the idea is that lots and lots of fruits and vegetables, whole grains, some legumes, a bit of dairy, a bit of fish, a bit of meat, plenty of plant source protein, some plant oils, and very, very small amounts of sugars and the foods, the treat foods. So a healthy food environment would look like this plate. And this kind of food would be available to people, it would be affordable to people, it would be acceptable to people, and it would be appealing and delicious and tasty to people. So we are way, way, way from that place right now. We are so far off if you consider this. And what you see is good in this sense, but this is more the norm that we have to be concerned about. So that's a healthy food environment. What is being done to create a healthy food environment? This is the nourishing framework which I established when I was head of policy at the organisation World Cancer Research Fund International back in 2013. And what I was doing here in putting this policy package together was to say what can be done in food environments to make healthier food environments, what can be done in the food system, and what can be done on behaviour change communication. So the NOIS at the top are the main policies that are being taken to improve food environments from really an obesity and NCD perspective. And nutrition labelling, offering healthy foods in public institutions, using economic tools like taxes, restricting advertising and marketing, reformulation to improve the nutritional quality of the food supply, and healthy retail and food service. And these are the things that were being done around the world that most, if anybody was taking action, they were taking action in some of these areas. And these areas are still the main areas that, that countries are taking action on if they're concerned about healthy diets, mainly from an obesity perspective. So that's been around for quite a while, and I think the Nourishing Framework has about 530 actions at the last count. So clearly governments are taking action, and industry and other actors are taking actions to improve food environments in some ways. But what I'm interested in more and more is what city-level authorities can do, particularly on food provisioning and retail environments, because that's where we see a lot less consistent action. And I believe that unless we fundamentally alter how we shop, where we shop, what is available in where we shop, and where we buy food when we're eating out, we haven't solved the problem. And all of nutrition labelling can appear in retailers. All of these things can appear in retailers, but let's focus the mind on thinking about what food provisioning environments and how they can really look differently, and what can city-level authorities do to do that. In my next slides, I'd like to acknowledge Mark Spires and Anna Isaacs, who are sitting right there, who are two of my postdocs who have been doing fantastic work in this area, and some of the work I'm going to show has been worked very closely or led by them. And this is one which Mark was leading on, and is something quite fresh that we've been working on, isn't published. But it's trying to pull together what can be done to improve food environments from a food provisioning perspective. I've adapted what we've done to take it down to the city level and to narrow it down a bit. But what this does is to summarise the type of actions that city authorities can take to improve food environments. So there's neighbour planning and infrastructure, things like zoning, licensing, so that to take certain stores out and to invest in new stores selling healthier foods. There's financial incentives that can be done. I'll go through this with some more examples in a minute. There's restricting marketing en route to retailing and food provisioning. There's alternative food provisioning models. So I mean things like farmers markets, kind of alternative types of shops, urban gardens, community-supported agriculture, and ways of supporting those. And then there's the inside of store environments. And the levers there are using certification schemes and partnerships, supporting services for small businesses, as well as regulations and legislation. So these are policy levers that city authorities can do. There's lots of other actors in this space that can do also a lot, but these are the levers that, that city governments have at their disposal. So let me give you some examples of what's been going on in a few places. I focus quite a lot on the US and the UK in these examples. So examples of what cities are doing on neighbourhood planning and infrastructure. Zoning and licensing. So the first part of the UK, the first local authority in the UK to ban new takeaway outlets from opening within 400 metres of schools was a borough of London called Waltham Forest. And so the idea of that was to try and squeeze out some of the bad from near schools in order that school children weren't so tempted to go to takeaways. On the other side, the food retail expansion to support health programme, the FRESH programme in New York City, is all about trying to get the good into these neighbourhoods by providing financial incentives, zoning and financial incentives. And financial incentives basically involves exemption from various taxes, so that neighbourhood grocery stores are more likely to come in and serve those underserved communities. And there are things like, and there's requirements, like they have to have 50% of their space of fresh food and these various requirements in order to get the kind of business tax reduction. Some examples from alternative food provisioning. Some great examples from cities in Brazil here. The city of Curitiba in Brazil, which some of you may have heard of, some of you may not, have got a really exciting programme designed to try and improve access to good food through its residents. And it's they take a very comprehensive approach. And they've got a whole range of different types of shops and markets designed to serve people on low incomes, such as the family shop, which that picture shows there, which enables families to access stores selling foods 33% cheaper. So these are stores that are kind of set up by the state that you enrol to, and then they're selling foods at a much cheaper price. Another one is around providing permits to particular retailers to distribute fruits and vegetables at a price much lower than conventional markets. And another one, sorry for the error in the brackets here, where fruits and vegetables are sold at open markets at cheaper prices. So these are really about changing the business model and using the public sector to incentivise and invest in a public sector which is an alternative to the private sector in serving people on low incomes. But what's important about the Brazilian approach, and this is the same in the city of Belo Horizonte in Brazil, is that these programmes are generally open to all and universal, so that anyone can join, so it reduces the amount of stigma. Another form of alternative food provisioning, of course, is urban agriculture and community gardening. And when you go to the Global South, a lot of the focus on improving food environments has been around actually addressing food insecurity issues and using urban agriculture and community gardening approaches to that. And there's masses of examples now, particularly in Latin America and in Africa, of these kinds of programs. Madagascar, and I can never pronounce it, the capital of Madagascar has an award-winning program where they have these micro gardens in low-income neighbourhoods where people are growing vegetables that they can then eat themselves. In Dakar, there's one which is run by women, which is actually micro gardening on tables. And Quito, which is one of the longest, in Ecuador, has one of the longest examples of an urban agriculture programme with thousands and thousands of allotments. And what they've now done is establish markets specifically for the products from those markets. So it's not just for self-consumption, it goes through to local markets as well. So that's alternative food provisioning models. Another example is inside stores and outlets. I'd like to feature an example from London here, where this is a kind of scheme where you certify places or give awards or some kind of credibility for taking action. So it's not mandatory, it's voluntary, but the Healthy Catering Commitment for London encourages businesses, fast food takeaways, small businesses, outlets, catering outlets, that have to meet certain requirements for making their food offer healthier by awarding them with the Healthy Catering Commitment, which looks like that. But other cities have gone for a regulation, a legislative approach. There's about 12 cities in the United States right now, many of them in California, which require by law all fast food outlets to make water or milk or a healthier drink the default beverage in children's meals as opposed to sugary drinks. So these are the types of policy levers that cities have at their disposal to work a way to try and improve the food environments for their citizens. And I've deliberately given a wide range of different types of examples there. What do we know about impact? Again, thank you to Mark Spires, who's been leading on a review which we have been producing for the UK Department of Health on this. What do we know about the impact of these things? And we've been looking not just at the city level, we've been looking at the national level. And in fact, many of these things can be implemented at many different levels. But I've used the word plonking deliberately. I was thinking, is that a common word, plonking? I think it is. But what is known about impact? And when we're looking at this, we see a very clear difference between increasing the good and removing the bad. Sorry to use such awful crude terminology, which I don't really agree with, because I do agree with a healthy diet. So I know that the good and bad is problematic from some perspectives, but just for simplicity, there are these differences between increasing the good and removing the bad. So when you look at the evidence on increasing the good, that's actually where most of the evidence comes from, and most of the outcomes are on fruits and vegetables. But what we find is that if you just say, okay, we've got a food desert here, we'll get a nice healthy food shop and we'll plonk it in and we'll think that everyone's going to come running and it's all going to work, it doesn't. And what you actually need to have is a community engaged with that so that there's ownership. I was talking very recently with somebody who runs a programme in London which aims to get healthier food to dads, actually to single dads. And he was telling me that in London, and I've heard this from in my work in London in a range of ways, but this, the most recent conversation I had in there, I said, what would happen in your community if a shop came in from the outside and plonked itself down? Would everyone come running and say, great, thank you? And he said, no, because poor people are embarrassed about being poor and they don't want to go out and to say, in this particular community, I don't want to generalise, in this particular community, and that means actually that there's not very good community relations, and people will stay very, very close to home, and they won't want to go out to a strange place if they don't feel any sense of ownership around it. So there's challenges in this very particular community which is going to be different in another community. And I think that was a good example about how you need to think more effectively about how you're going to do that. In-store interventions do have impact if they're designed well and if they're based on effective engagement with stakeholders. And alternative food provisioning, which there isn't nearly enough evidence, can have impact, particularly if it's linked with financial incentives and more affordable prices. Now, when it comes to restricting the bad, restricting the opening of new takeaways in isolation of anything else will not have an immediate impact. I hope I'm not saying anything against the Mayor of London, because I know that he's proposed something and there's been lots of challenges. That's not, still plenty of reasons to do it, lots of good reasons to do it, but the point is that if you can't imagine it's going to have an immediate impact when they're so, and also when they're only focused on particular kinds of takeaway. And even evidence on in-store promotions, that it's quite clear that in-store promotions do affect what people buy, including children. So they do encourage unhealthier purchasing habits. But actually, when it comes to the effect about removing them, we don't actually know that much at all. So actually, when you look at the evidence base, there's some interesting learnings from the evidence, and this isn't all the evidence at all, but it's actually rather limited, which is quite a bit of a shame, really. It'd be nice to have more evidence. But actually, when you look at the type of evidence that there is, they tend to take single interventions and say, right, what is the impact of this intervention of X on Y, and try and isolate it and narrow it down. But that's not really how things work in people's lives. there's not one single thing that happens in people's lives. It's not just about a new supermarket opening or taking away this takeaway or something that's happening in a particular supermarket. People are living a whole daily life, and food environments are about that daily life, not just about very simple cause and effect from isolated tweaks into the environment. It's how it all fits together. And what we don't have is evidence that shows if you're to do a suite of actions together, what will it actually mean? So the evidence base is there's a lot of learnings from it, a lot of things we can learn, but it's inadequate. So given that, city authorities are moving forward and attempting to make changes to their food environment. And they are doing that without perfect evidence. Evidence is never perfect. But that means that we can't wait for the perfect evidence to come along to say this is what they should be doing. I say how can city authorities be most effective and show this picture here. At the bottom, it's a picture that was taken, I think this one was in Valencia at one of their annual meetings of the Milan Urban Food Policy Pact, which is one of the global networks of cities who are very active cities really wanting to make a difference. You've got the Partnership for Healthier Cities, which is a Bloomberg philanthropies initiative, which is around non-communicable diseases, including healthy eating. Initiatives like the African Centre for Cities is trying to get cities to focus more on food. Cities changing diabetes are cities working on trying to improve diabetes and also looking at food. The C40 Cities Network is about climate change, but that came out with a report last week showing that reducing consumption in cities is going to be essential for climate change, which implies that we're eating differently. Sustainable Food Cities is the network in the UK. So there's a ton of action that is going on around the world in cities. How could we say, if you're really going to make a difference, what is it going to look like? What are you going to do? And the first thing I would, if to ask the question, what would cities do? The first thing I would say is understand the lived experience of your residents. And that's what we've tried to do in the London Child Obesity Taskforce. What I'm about to present has not been published yet. It'll be published in a week or so, we hope. But what we've tried to do is to understand what life might be like for people living in those food environments. It's also the work that Anna Isaacs, who's sitting there, is leading for our Centre for Food Policy, and some of the things I've highlighted comes out of that work. This is completely different work. This is not a research project. This has not been done by rigorous research. This was anecdotal profiles of children that we put together. So I want to emphasise it's not representative. We're not trying to be representative. We're trying to be indicative of children's lives. So this is some profiles we put together at the London Child Obesity Task Force. And so let's take Justin. And this is kind of a composite of boys and girls who are his age. And he is 2.5. He lives in outer East London with his single mum, no close family, 1-bedroom high-rise flat on the 6th floor. Mum is out of work, very, very limited money, very little support for the mother overall. I don't know whether it's possible to read this, but doesn't sleep particularly well. Watch TV in the morning. When goes to nursery in the morning, it's a very difficult walk, and walks down the high street full of takeaways and convenience stores. Sometimes can be challenging to go to nursery because it's so difficult to get there, and so it's difficult to form relationships at the nursery. And then it says fruits and healthy snacks are available at the nursery, but I don't like eating them. I'd rather eat the processed snacks I'm used to at home. So some people might say to this, oh, stupid mother, terrible parenting, this is awful. The mum's giving snacks at home. She really needs to get better, doesn't she? Very, very judgmental. Very, very judgmental. And then moving on, it says, we travel down the high street and my mum gets me a snack. And it says, I'm a fussy eater. So mum no longer tries to give me the fruits and vegetables and gives me processed snacks I ask for. These are cheaper and more convenient for mum to buy. And then mum goes to buy groceries at the discount supermarkets, choosing what is available at sale prices. And we carry these on the bus home. So that's an example of some very simple things that are happening in that boy's life. And I'll highlight these points here. I am a fussy eater. This is something that's coming out strongly from the work that Anna's been leading at our Centre for Food Policy, about children being seen as fussy eaters and parents feeling out of control. And when out of control, a bit out of your own life, low self-esteem, kid pestering you because of that food environment out there, because of the cartoons, because of what's available in the high street, because unhealthy food is extremely tasty and delicious for children, then that child then becomes accustomed to that. And when you have very little money, living in a situation of stress, and there's not that much pleasure in your life, really, in the sense of they have to stay at home all the time, they've got very little money, that's just and you've got your kid pestering you, it actually makes a lot of rational sense to do that, to give your child a bit of pleasure while they're at home because there's not much else that you can do. And what happens is, of course, is that if the mother's not given sufficient support when the child is very young, and they get very confused, as most mothers do, myself included, and pretty much every caregiver who has children, the child becomes used to doesn't get the exposure to the fruits and vegetables that would be healthy for them. And therefore, when they go for nursery, they are so unhabituated, then it's very difficult to get them into the habit. But the other point here is about buying groceries at discount supermarkets. The idea that people are going and having to find the cheapest food that they possibly can in any way that they can, and this high level of reliance on discounts and the cheap food stores, and really searching out, constantly going from store to store, trying to find what is cheapest. And then getting home, you have no table, you have no kitchen, and you have a microwave. I don't think smashed avocado for breakfast is going to make it. It's just not going to happen. So it's when you look at these things in the context of the reality of people's lives that you realise how hard it is to change it, because you've got an environment which is promoting unhealthy food, and you've got a life which makes it actually very rational and sensible and affordable to eat healthy food. Trying to have a good, decent relationship with your child matters, and it's a rational thing to do. And if that means the best thing to do is to buy a cheap, unhealthy snack, that's what you're going to do. It's a sensible thing to do. Hannah is older and lives in a bit of a larger place, a bit further out of town. But what happens to Hannah is that her parents are in work, both of them in low-paid work. They have to get up, they have to leave the house at 6:30 in the morning to go to their jobs. So that means that Hannah can't have breakfast at home. That means that she has to go to her grandmother. Her grandmother is sick. Her grandmother hasn't got time making smashed avocado on toast either. So she puts her in front of the TV with a sugary cereal. And that keeps her quiet. Rational sense. She's sick, she needs to look after herself. She's trying to help her daughter and her husband, who've got to go off to do two jobs that between them don't earn enough money to mean that they can be, feel good about the food they can bring into the house. So the point I'd like again is to highlight what's going on in the high street. That after school, if her mum picks her up, which she doesn't always do, but if she isn't working that day, or she's got a bit of a shorter shift than usual, her mum will go to the local discount supermarkets for groceries. And again, the mum will look around to see what's cheapest and buy lots to freeze later on. Because the mum is in work, it means that when they get home, she's running around trying to do all the household chores because her husband's still at work, working an even longer shift, and doesn't want to spend time preparing food and cooking. Very, very understandable and sensible. But they have a little bit more money because they're in work. And she likes to go, Hannah, because she likes to see all the cartoons that are being marketed to her, and pester her mum and say, "Can I have that? Can I have that? Can I have that?" And of course, her mum wants to do a nice thing for her daughter, and so she'll buy that food for her daughter. And then when they get home, they will have dinner together, often ready meals of frozen food for the reasons I've just given to you. But while mum's doing the chores around the house because she's busy at working and the husband's not helping because he's not there, she's watching videos on YouTube which has lots of advertising on them. So it kind of perpetuates this situation. So it's trying to understand the context, the full context of people's lives. And just very briefly, this is an older girl in London. In London, the chicken shop phenomena is really, really powerful. And what this example shows is that older children will go to chicken shops, not necessarily because they love chicken, but because it's cheap, it's affordable. But the main reason that they go is because they feel socially accepted. And it's a place where they feel that they can go and hang out with their friends and have a social life and otherwise a very limited life. And the unhealthy food is there. So my last couple of slides, I'd like to emphasise what I've learned from this process, as well as the work that we've been doing at the Centre for Food Policy in Great Yarmouth and Stoke-on-Trent and London as well. What will it really take to change these food environments? Well, what I've learned is it'll take a lot more than just changing food environments. In the past, I thought, right, you go to food environments, you sort out nutrition labelling, you do all these things that I talked about earlier, like changing the promotional environment in stores or bringing in a new supermarket or whatever. But this is what I think it will really take to make lasting change. First of all, people need to have the necessary knowledge to buy a healthy diet. And I don't, by the way, mean that people don't necessarily know what a healthy diet is. I think most people do in all socioeconomic strata, and that's not just the case in this country, it's the case around the world. But they need to have the knowledge to negotiate those environments. Do they really know what all those additives are in all those various foods out there? Probably not. Do kids have the knowledge about how they're being marketed to and manipulated to through those cartoons? Do they understand what those companies are doing? Probably not. So you need to have the knowledge, the full set of knowledge that you need. You also need to have the skills and the literacy. So you need to have the skills of how to negotiate stores that are trying to sell things to you. You need to have the skills to try and negotiate how to find food that is affordable to you. And it's extraordinary how many skills people on low incomes in situations of deprivation have. An enormous number of skills. I hate it when people say that they don't have any skills. They have a lot of skills. But they don't necessarily have all the skills, and need to look at that, and that goes across the socioeconomic spectrum as well. And certainly if people don't have the skills to cook, which might be the case, for example, with single men living in situations of deprivation, there's those kinds of gaps that need to be filled. But you can have the knowledge, you can have the skills, you can have the literacy, but if you don't have the assets and capacity, if you don't have the kitchen, if you don't have the space in your life because you're trying to work 2 jobs, then that's not going to be enough either. But if you've got the knowledge, got the skills, got the assets and capacity, you then need to have access. So if you don't have access to a healthy diet, then you're not going to succeed in having one either. And of course you need to be able to afford a healthy diet. But you also need to be in a socially supportive environment where when you're going out and spending time in a social environment, whether it's a chicken shop, whether it's a once every 2 weeks treat, whether it's going out to get something for your kids after school, that there is social support, that when you are socialising, there's something about it, or in your social networks, that is also supporting healthy eating. You've also got to be in an environment where you're not prompted to buy on a healthy diet all the time, all these things trying to pester you to buy foods that ultimately you don't really want to buy because you're trying to look after the money that you've got. But we've also got to be in a situation where we can enjoy eating healthy diets, and I think that's really, really important, that ultimately, if we're going to succeed, people need to enjoy eating a healthy diet. So when it's what will it take to improve food environments, I would take a people-centred vision to say this is what people need to have. And all of this requires a healthy food environment. So my last slide is really to say that if we're going to be effective, we need to achieving that vision where people have the skills, have the access, have the affordability. That's going to take some really radical change to food environments. But it's also going to take changes to the nature of people's lives as well. So my ask would be that city authorities should design and deliver bundles of action that recognise that unhealthy diets result from the interactions between people and their food environments. So that means talking about decent wages, decent jobs, fair prices for housing, alongside really effective voucher schemes that can stimulate fruit and vegetable intake, for example, as well as community-led alternative food provisioning systems in gardens in which communities actually feel empowered and engaged and can socialise in order that the healthy foods become more appealing for a whole range of reasons that might not have anything to do with food. Another example is, I think, that with the bombardment of encouragement to buy unhealthy foods, that we should just have strong legislation to get rid of all of those temptations, get rid of all of those prompts in all stores. But that also means we need to invest in social spaces where food is actually healthy. So it's not just being punitive. It's not just saying, you can't have that nice moment with your son because you can afford some cookies, but we're not allowing you to do that anymore. That's punitive. We have to do things that we're investing in providing social support around healthy food as well, and also providing support for parents. So it's those kinds of bundles of actions that recognise that interaction, which I think will really make the difference to delivering healthy food environments. Thank you.
Thanks very much, Corinna. That was really, really fascinating talk, and for me, just the way you articulated the importance of involving the community in these approaches was really, really, really good and really important. Now we're going to ask the other panel members to join Corinna up on the stage, and I just need to swap over the microphones. To pass that along to
Sure. So thanks for inviting me to this and for Corinna for that talk.
That's okay. So Brian, thanks for joining us. And you obviously worked for the Toronto City Food Policy previously and now working with the University of Oxford. It'd be really great to hear your experience in this, and particularly your experience of working in stores to change the environment and change people's choices.
Sure. Maybe I first talk about the experience in Toronto working with local government that really ties to your presentation. So I work with the City of Toronto on the City of Toronto Food Strategy. We founded that in 2010 following on the London Food Strategy. We didn't have the luxury of having a mayor who really saw food as the key priority. So a lot of our work was at the ground level, kind of working in the dark, trying to make things happen. And I agree with a lot of your presentation about what cities can do around removing barriers, listening to people about solutions. The big thing for us that was most effective was in creating small-scale solutions, finding things that were big enough to matter, small enough to win, where we could then change the conversation and make the policy changes happen. So, for example, we wanted to make changes around making healthy food available for people to sell in, equivalent of hot dog carts or through mobile vending. There were a lot of restrictions in the licensing rules around that. It costs $10,000 to get a license for these kind of things. It was very restrictive. So when we would go to the licensing people and talk about changing the municipal code, section 114, everyone's feet would go to sleep. And then people would just think about the worst possible scenario of why we should change these rules, and it would have a very negative tone. So we would work with, for example, Food Share, which is an NGO in Toronto that does a lot of food security work with them to create a positive pilot where we could actually show the positive nature of changing the rules. So we created the mobile good food market, where we took some city buses and transformed them into nicely designed mobile fruit and veg markets that today go to about a dozen low-income neighborhoods across the city and sell fresh produce. So we got a lot of media attention for that. If you did an analysis of that and looked at the whole economic ROI of the cost of the project and the benefits, probably wouldn't work out so great. But in terms of the marketing of the potential of changing how the city works and how the city can be a progressive innovator around expanding access to healthy food, it was a huge success, and it really changed the tone when we went back to City Hall and spoke to the licensing folks, and they saw all the positive attention of this. Then they saw the whole reason why they should be shifting the policies around these things. So that kind of thing was really helpful in moving things forward. So in my current work now in academia, the project is looking at sustainable diets and looking at how we can do actual research in stores, whether it be supermarkets, restaurants, other consumer environments, to test what are the kinds of strategies that can shift people's purchasing habits towards healthier and more sustainable choices. So there's a great reason to do that, and that we still don't know a lot about what exactly works to shift people's diets in the real world. We've got a lot of research of different quality that has happened in virtual environments, has happened in student canteens and so on, but not a lot of research in real environments. So we're doing that kind of work, and as I say, on the one hand, there's a lot of knowledge gaps about what works to shift people's purchasing habits. At the same time, if we were all had the luxury of being able to redesign supermarkets from scratch, we probably would know how to remake them so that they actually did promote healthy, sustainable choices. So, we would have the healthier food would be less expensive. Our steaks would be a lot more expensive than they are now. We would have things positioned where the healthy, sustainable choices were at eye level. We would make use of the end-of-aisle plinths. We would shift the availability of healthy and less healthy food so that the healthier food was more prominent in different categories. We would promote social norms. We would tell people about how other people in the community are making healthier and sustainable choices. We would actually have information on the environmental impact of our food choices. So there are ways you can imagine how we would reshape supermarkets to do that, even though we don't know exactly how and which strategies work and when. So the work we're doing now is trying to test some of those strategies in real environments, which again is a great idea in theory. Once you get to the practice of doing this, obviously we don't get to make supermarkets from scratch. We have to deal with supermarkets as they are, which, as you know, even as friendly as they are in talking to us about sustainability and working with us to understand what works to make the planet better, we're always second to the profit motive. So that's always a difficult thing to do. And given that we're in academia and we want to be able to look at the data and analyze it and make that publicly available, there's a lot of legal red tape that goes into these research collaborations. So we have to go through data sharing agreements. Sainsbury's is our core partner for this project. It took about 15 months to get to that point. There's all kinds of other layers of being able to access the data to show that we have the right controls in place. So there's just a huge barriers in place in being able to do these kinds of projects, which is why a lot of people don't do that. But we are at the place now where we're able to do some experiments, testing things like placing meat-free alternatives into the meat aisle. So just positioning them in the meat aisle and whether that makes a difference in terms of people's purchasing of those. Doing things as well as social norm messages. So we're doing some tests right now in a restaurant chain where we have some social norm messages promoted on the screen that are showing that a lot of customers are now eating veggie alternatives and seeing whether that kind of social proof information can increase the purchasing of that. So our research in that area is still kind of in the early stages. We still have some projects that we're working on developing, but I think the key thing for us to take away for that in working with companies is, same as I said in working with cities, is find those really small projects where you can actually prove the concept of your partnership, where you can actually build those relationships with those companies, and hopefully that can lead to bigger and better things down the road. But just getting your foot in the door, even if it's not going to be an ideal, scientifically rigorous study, just getting it in the door and building those relationships is the key to kind of get the momentum, make it happen.
Thank you, Brian. That's really, really interesting. And so, Monica, you're a resident from Oxford, and it'd be really interesting to hear from your own experience. What changes do you think would be most significant in improving the food supply in Oxford?
Hello, thank you for inviting me. So yeah, I was living in poverty. I was homeless. So I managed to sort of come out of that. But it's being able to access more healthy food because it's more expensive than it is to buy junk food. So we was basically eating a lot of processed food. So because we couldn't afford healthy food. Also, as there's a big homeless sector out there, is for the homeless to access healthy food, being able to access any type of food. So there needs to be more availability out there.
And what sort of things do you think would help? Like, what would you like to see?
So there would be more places for the homeless to go to get food, to be able to access healthy food, more for the shops to lower the healthy food down and make the junk food a bit more expensive.
Yeah, and where do you go to shop? Where were you going to shop?
So I shop in Sainsbury's.
Yeah.
Because it's more local to me than it is any other shop.
Yeah.
But we have now got the weight trays around the corner from where I live, so we have got the access now to be able to go refill our pots by things. I haven't tried it out yet, but I will be trying it.
And in the past, did you find there were schemes that were helpful in terms of providing you food?
We relied on food bank quite a lot, but you're only allowed to access food bank 3 times a year. So what did you do in the meantime? Not really much. There wasn't much support from anywhere really.
Yeah.
So if you used up your 3 times a year of a food bank, then you'd have to find other sources to gain food. So I was basically going without food to give my children food.
Yeah. Thank you.
So we've been doing a lot of visits with Good Food up in London, Northampton and Newcastle, and looking at how their services would be more accessible if it would work in Oxford. So we visited Lambeth GP Centre, which the GPs grow vegetables alongside their patients, and then they go on to sell the vegetables, and the patients then go on to be able to cook the vegetables and eat alongside with the GPs as well, which was a really good, amazing garden they had up there. So they were growing vegetables, herbs, and then they went on to hospitals and sold it at the hospital grounds.
Great. No, that sounds... And is that the sort of thing that you want to be replicating?
We want to have a look and see whether that would work in Oxford, but you know, as GPs haven't got a lot of time really to be able to put that in practice in Oxford. Yeah. And then we looked at food pantries, which is a membership where they pay £5 membership for a year, and then they can access like 5 bags of food whenever they need it. And then we saw a project up in Byker in Newcastle, which is where you pay £2 membership, and then you can access things for like 5p, 10p in a food pantry. Yeah. And you can also earn points as well. So if you haven't got enough money 1 week, you can use your points and gain food from that.
Okay. Thank you. Well, thanks very much for sharing that experience, and look forward to hearing more later. Francis, you're working for Good Food Oxford here as well. Can you tell us a bit more about what's happening and what some of the challenges are, and also what the lessons are for other cities that want to be developing these sorts of programs?
Sure. So Monica and I know each other from the Good Food Oxford Food Access Alliance, which we've been working on for about the last year and a half. This is with funding from Sustain. They have a big national initiative called Food Power to set alliances up in various cities across the country. My role is as evaluator, but I think I'm a friendly evaluator, so it's not really about coming in at the end and saying what was done right or not done right or what the impact was. It's much more about a learning role. So it's supporting strategy development, supporting ongoing learning amongst Alliance members. Some of the work is built on an earlier study that I did on food poverty in Oxford. As was said right at the beginning, Oxford is an affluent city, but it has some very significant pockets of poverty around the city as well. I won't talk about that now, but I'm happy to answer questions on what we found in that food poverty study. So the rather lofty goals of the Alliance are to reduce food poverty, or at least to hold the line, given current circumstances, conditions in the country, by increasing accessibility and affordability of healthy foods for certain vulnerable groups in the city, and to make local strategy and policy more responsive to food poverty. How do we do that? The core strategy is bringing together people who wouldn't usually come together. So bringing together people like Monica, who we call our experts by experience, who have lived experience of food poverty, with service providers and policymakers in the city, having them sit at the table together and try and understand, rather as Corinna was saying, what the experience of food poverty is really like holistically. And in that process, we want to give voice to residents with experience of food poverty. So we're really putting them at the centre of the Alliance. So we started off with them. They have shaped the way the Alliance has come together. They have shaped who else we've invited from services and policy arenas onto the Alliance. They decided on the initiatives that were visited around the country. They are largely doing the process of thinking about what we've learned and what may be useful within the city. So we hope that goes some way towards an asset-based model, recognising that experts by experience have a lot to bring to the table. It's perhaps something like the people-centred approach that Corinna has talked about. And then we will move on to either establishing new initiatives or supporting existing initiatives or some combination of that, which are likely to look like the alternative provisioning kind of models that, again, Corinna was talking about, and exactly the kind of things that Monica was making reference to. And then we have a quite stringent communication strategy, so thinking about who do we want to reach with information, what are the messages that we want to take them, what are the particular policy targets that we're looking at in terms of making policy more responsive in the city. Challenges, finding time for everyone to meet, different kinds of work schedules. When we bring experts by experience to the table, it's not their job. For us, for policymakers, for service providers, it's our jobs. For them, it's not. It's on top of their jobs. So the first challenge is time and finding times when we all coincide. The second related to that is the burden that it places on experts by experience. So again, it's not their job. It's usually something extra that they're very committed to. They are very central to the Alliance and doing a lot of the work. And so we have to be very aware of that. They receive a small stipend, but it's nothing like the salaries working in the organisations that also come to the table. And then thirdly, bringing in professionals in a committed way. So there's a lot of dipping in and out, and there's clearly not recognition yet of the value that this approach may bring in informing their work. And in terms of lessons for others, it's quite early. We can't really say what we've learned yet. We know that part of our approach is quite unique. So all of the alliances that are funded by Food Power came together in Newcastle at a conference last week. We're the only ones who have put experts by experience right at the centre and started with them and got a very firm base with them before inviting others in. And it remains to see whether that is a fruitful approach if we do successfully go some way to redistributing decision-making power. That, again, sounds very lofty, but we hope that's what we're chipping away at in some small way. But there are lots of approaches to this work, and we're doing one of those, and there will be many other ways of coming at it as well. So in about 2 years' time, we might actually be able to tell you what we've learned. Thank you.
Thank you, Frances. And so lastly, Jamie, so you're from the Greater London Authority, where you've been working on the London food strategy. We hear quite a lot about the London food strategy. Can you tell us a little bit about what the contribution of business has been in this space linked to the London food strategy?
Sure. Yeah, so we've been working on the new version of the London food strategy over the last year. It was published in December last year, and there's some key policies in there that I can talk about in a bit more detail. But a key thing for us was to structure that document in a way that was focused on the settings that are relevant. So we looked at good food at home and food insecurity as one of the key themes. Good food economy, shopping and eating out, which is the most relevant section to this discussion. And everything else from community settings, pregnancy and childhood, good food for the environment, and community growing. So in terms of some of the initiatives that have supported the second theme around good food economy, shopping and eating out, We've had to work very closely with industry to deliver some of the programs and some of the commitments the Mayor's made through the food strategy. We've worked really closely in terms of how we set that strategy with business, and Corinna will back me up here in terms of the Child Obesity Taskforce being very much business-led, taking a different approach than we've ever taken before in City Hall, in that we're doing much more engagement with businesses themselves, with industry, with the sometimes seen as the bad guys, but understanding their challenges and how we can work together to make real changes. The London Food Board, which Corinna also sits on and has led the development of this new food strategy, has representation from across business, hospitality, retail, sort of tech food entrepreneurs. And then in terms of delivering some of the programs that sit below that, we've worked very closely with boroughs, but also the businesses within each of those boroughs. Corinna talked about it a little bit earlier. The healthy catering commitment is a really key policy where we've used a very small amount of funding, but a lot of leverage across the boroughs to get 800 fast food takeaways to sign up to that commitment. And yes, it's voluntary. Yes, it depends on the commitment from the borough. But it is something actually we're looking to take a step further. So we talked a little bit about some of the changes to planning that we're looking to bring in through the London plan. The restrictions around new takeaways opening within 400 metres of schools. And then the ones that can open, that aren't 400 metres within a school, mandating the use, the accreditation under the healthy catering commitment. And actually then looking at, it's not just about the high street takeaways, the small independents, who can make some of those really small changes to change their offer, the small chicken shops, for example. But actually, if we're bringing this requirement to deliver the healthy catering commitment across any new fast food takeaways, we need to set a higher bar for the big firms. So we're now looking at a second tier of the healthy catering commitment, which would apply to the larger firms. And at the moment, we'll see whether the London plan continues to include a proposal for that to be mandatory. So moving from that voluntary accreditation type approach into actually including that in planning legislation. Good food retail plans is something we're looking at now. So working through boroughs to develop plans within 5 boroughs where they would work in a similar way to the healthy catering commitment to encourage, to set a plan for how they would encourage food retail to change some of their practices. Some of it overlaps with the work that Brian's been talking about, and some of it overlaps with the work that we do through the healthy catering commitment. And then we are also looking at how we can use the leverage we have as City Hall, as a funder of businesses and initiatives. How can we do that? So if we're funding a food business or a food initiative, how do we ensure that they are good food businesses and they're delivering outcomes that the Mayor would expect to see? So looking at something like a kind of good food business charter is something we're really keen to develop at the moment. And then finally, looking at how we can leverage the GLA's assets across the group. So we have a huge amount of assets, and one of those is the TfL estate. So we have a huge amount of retail on that estate, and that's something we need to explore further in terms of making sure that as the landlord, we can ensure that there's a healthy offering. We don't want to stop retail units and platforms from selling chocolate bars, but we want to make sure there's a wider, healthier option. So that's really important. And then the biggest initiative which we've done through the food strategy would be the restrictions on advertising of high fat, sugar, salt products across the TfL estate. So the TfL estate is the largest advertising estate in the world by revenue. It counts for 40% of all out-of-home advertising in the capital. And we, as of the 25th of February this year, introduced restrictions so you cannot advertise direct high-fat, sugar, salt products. You can't use it in an advert for financial services to make it sexier. The amount of people that use cake in adverts for financial services is unbelievable. So that was a really tricky one to implement, but we've done that. And also just advertising a brand. So the big, we've all seen the Golden Arches and other brands sitting there telling you, come out the station, that's where you should be going. So if they're going to do that, fine, but they need to promote their healthier options. So really changing the messaging, and it's live, it's happening. we've removed all of those products from the world's biggest advertising estate. So it shows what we can do when you use that leverage, and you work quite bravely with industry as well.
That's great. No, thank you for sharing that with us. You reminded me, I was just discussing with Corinna in terms of counter advertising, and I was in a cafe in Yorkshire, and there was a sign on the wall which said, "Skinny people are more likely to get kidnapped. Stay safe, eat cake." So you have to laugh at the Yorkshire humour, but that's the sort of thing we're up about. So we've heard a tremendous lot here about the different initiatives that are ongoing, and this is just a taster from sort of Oxford and London. So clearly there is a lot of action. I'm going to turn to questions to the floor now and ask a couple of questions and then come back to you. Before I do that, just to remind everybody that we are recording this, so if you don't want to be recorded, then I would stay quiet and come and talk to the panelists afterwards. And people are also tweeting and using social media. I know because it's going off both on my watch and on my phone every time somebody does a tweet. So I would like to know from the panel, just to get them thinking while we're asking the questions, is how will we know we've been successful? So that's one thing I'll come back to you on, but first of all, some of the questions to the floor. And you'll need to have a microphone.
Can you say who you are as well?
Hi, my name is Andy. I'm a lead urban health scientist at Georgia Institute. Really appreciate the powerful presentation with the personal anecdotes and the excellent panel discussion. My question relates to the issues around food access. So to give you an example, I live in Summertown where there are 4 different groceries competing with one another, but not all places are like Summertown. And I would like to see what your thoughts on the role of technology using some sort of food service delivery or some sort of online shopping programs to potentially address the questions around food access where there are lack of good, healthy food supply.
Okay, so that's about the use of technology in terms of tackling food access. We'll take one more question and then I'll turn back to the panel.
Cheers. Oh. Hi, I'm Maddie. I work on access to land for regenerative agriculture in Bristol, and I'm particularly interested in how public bodies like the London Authority or Bristol City Council or others can work as enlightened kind of landowners to make land available affordably for social enterprise, non-profit models for more and more food growing. So a lot of the kind of person-centered stuff was about not having those beautiful and social and healthy places to hang out for families, for young people, where they can eat well, they can start to shift thinking and culture and skills around food. And from what I've seen, kind of community-led, community-engaged food growing enterprises tick all the boxes. So I'm just wondering what public sector landowners, how they can initiate a move towards making non-profits work so that they can sell at lower price points embedded in communities.
I think there's a couple of questions wrapped up in that, but particularly how do we make land available for the local community food projects? Yeah. So maybe, Jamie, I'll come to you first to respond to that one, and then we can come back to the other issue, which was the use of technology in terms of food access.
Sure. So one of the things we're doing in London is to include provision within the London Plan, our spatial strategy for London, so we can protect space for urban growing. There are some amazing initiatives already happening in London, and we want to see more of that. So the food strategy has a specific chapter to address that and come up with some ideas about collaboration. It's a really interesting point around making it more affordable. So it's fine trying to build it into planning legislation, but how do you make those models more viable? It's a really good question. I don't think we've got the answer to yet, but we are developing models for how we would do that in other areas, for example. So we're looking at how we can make office space, retail space, and other opportunities for businesses who have models that mean they can't afford the rents in London, and to allow that a discount as such, developing affordable rents that are based on turnover, for example, one of the approaches that we're looking at. And there's no reason why we can't look at the same approach for urban growing, with some interesting stuff around the green belt as well that we can look at in London, and making sure that we allow better exploitation of that space for growing.
Thank you. And I don't know, Brian, did you want to respond to the question about use of technology in terms of improving food access? Is that something you can share your experience on?
Sure. So, I mean, my first thought around that is, yeah, there could be all kinds of innovations that could happen there around technology and improving access, especially in lower-income neighborhoods. Always have to not lose the sight of the fact that, you know, people who are on low income want and deserve the same shopping experience as the rest of us do. So, you know, my work in Toronto, we would work with a lot of communities in low-income areas, and they would have a discount grocery store not far away. So in theory, they have plenty of access to cheap food, but when you would go in there, it would be a place that was not always very well stocked. It was usually dirty. The security guys would follow you around if you looked like you didn't have a lot of money. So people didn't feel safe or secure or respected when they went to those places. And talk to folks who shop there, and they would say that they would, even though they didn't have a lot of money, they would go further out of their way to shop at a place where they actually felt respected. So that's something you have to not lose sight about. But again, like I say, there could be all kinds of innovations around technology, and I think that the important thing here is for local governments to see themselves as innovators and conveners of these partners to come up with these solutions. And that's the difficult part. Often with local government in general is very risk averse, so that's a big shift in culture for local government. But we try to do that in Toronto ourselves with occasional success. One of the things that we did create there was we came up with the idea of having an online food ordering system for community food programs. So traditionally, food banks or meal programs, they would go and they would have their volunteers go to the local supermarket and to buy food, which they wouldn't get a lot of bang for the buck, not always healthy food. So we created an online system called foodreach.ca, where we partnered with a distributor, and if you are running a food program in Toronto, you can go on there and you're able to aggregate your purchasing power with the other NGOs in the city, which is collectively about $50 million a year that's spent by them. So you're aggregating your purchasing power with them through this site, and then you're able to get small deliveries, where with the big distributors, you'd have to have a minimum of $500 spend. So you get small deliveries on time for healthy food, and you'd be able to get good prices because you're aggregating the distribution. So that's the kind of sort of technology innovation that we came up with in Toronto, but only when you had that space within government where you could bring together these partners and have that time and space and authority from your bosses to be able to come up with these kinds of innovations.
Interesting. Anybody want to comment on that or other questions? Question from the floor. Lady in the yellow and then Justine in the grey. Start with the lady. Yeah.
Okay. Thank you very much for all what you shared. I'm a food engineer. That's my initial profession, and then I was challenged by many colleagues on that. I mean, saying that the industry, the food industry, for instance, doesn't really want to create. They are just there to help consumers get what they really need or what they are after. And I'm doing a PhD at Reading University, which was challenged a lot of times with saying that we have to use numbers. We have to use quantitative analysis to really understand the complexity of obesity, which in a way I understand. But at the same time, I started using cases from Corinna and her studies on trade in Mexico. And I was told that that was anecdotal and that was not proper research. And my question is, I will elaborate more on this, but my question is to Corinna particularly. If you think that, I mean, of course, obesity and diet-related disease is a really complex problem and not easy solution. It's not one solution to solve everything. But it seems to me that the commitment from local like authorities or the state and industry or key actors in the food sector are really not committed to make a change in the food system and to make things happen. And that can be seen in different levels. One example to see how complex it is to understand the impact of what we eat and how to make good choices is there was in a local school in Oxford, I talked to one of the senior researchers, say that we have our children in the same school, to say he's a parent governor in this school, and he's one of the leaders in this field, to say, are you happy with the meals that the children are having? Because it's, for instance, this is a company that provides services across the country, and it's very poor quality food. And the answer from him was like, well, at least they have something to eat. So, I mean, if we are not, if we as consumers or actors that we are trying to find solutions, we don't see commitment from key actors, it's going to be very difficult to make changes. Yeah. Other researcher, senior researchers said, well, if they cannot, poor people cannot afford to eat healthy food, there's vitamins in the pharmacy, so they can have that instead of fresh food. I mean, if that's the kind of question from very, very senior people in the field, what can you expect?
Great question, Corinna. Did you want to respond to that? And then, Francis, it would be great to hear your view on that, and also on the addressing the food access as well in Oxford.
Well, there were several things that you said there, but let's pick up on the last point about the lack of commitment in the system. I mean, it's true that on the table here, there are a couple of reports, if anyone is interested, that we've just started to produce at the Centre for Food Policy, which is about what food policy is and how it needs to be different to really address the fundamental nature of the whole range of food systems challenges, as well as the meaning of taking on what is the whole food system that underpins. I didn't talk about it. I didn't have time in my presentation to look at the other work that I do, which is about the bigger food system that underpins all of these food environments. But if I'd said something else, it would have been, you've also got to change the whole food system, which is incentivizing the food environments to be there in the first place. And so there's tremendous amount of change that needs to happen. And there is change happening. I mean, I gave some examples there. We've heard some examples from colleagues. But the degree of change that needs to happen is enormous. And I think that it's hard to see. Sometimes it can be easy to get lost. I would argue that the same degree of change is needed in the whole way our economy works, the whole way, there's a lot of change that needs to happen in the world. But what we are seeing is that there are people who are leading that change. And what I think we need to do is to build capacity in the system for change. So, for example, if you just take something simple like school meals, you think it's simple. What is the main reason why the school meals aren't actually healthy? It's because head teachers don't have the capacity, governors don't have the capacity to actually get their head around it. You know what? I'm really, really, really busy. I'm totally stressed. I can't even afford pencils for my kids. Oh, and I'm going to start worrying about food. So that means that there are a lot of really rich people in this world, sickeningly rich actually, and there's a lot of enormous wealth in this world going around trying to find things to fund and to spend their money on. What we actually need is investment in the basics of building the capacity so people can actually do what they know that needs to be done, rather than tinkering around the edges. Like I said, I'd like to see every prompt that encourages people to, because even if it's so cheap, to buy the unhealthy food, banned, I mean, gone, out, stopped. Stop messing around, tweaking with it, just do it. That's not going to happen because it's all got to be proportionate and it's all got to be following the evidence and blah, 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 blah. So yes, I mean, I don't quite know what I'm saying here, but all I can say is that those of us who believe that food has the power to do good needs to carry on working and carry on working hard and trying to infect others, that it's also important. And so that we infect the system with the belief that change can happen and it's possible, and just keep on keeping on. All I can say, really.
Yeah, I think that's really important. I mean, Frances, in Oxford, what have the challenges been in terms of? I mean, the question here was that people in power aren't listening. What have the challenges been to involving policymakers in the programme in Oxford?
What haven't been the challenges in involving policymakers? As I said, we're in early days, so I should perhaps not be too damning. We have had responses of interest and commitments to come along and be part of the alliance and hear the voices of others and listen to what is said. The food poverty report was actually well accepted in both councils. They both put a very tiny amount of money into it, but seemed to like what came out. And interesting, the question around forms of evidence. So that was largely a qualitative study, drawing on the voices of residents in 2 of the regeneration neighbourhoods in Oxford. We quantified one kind of evidence that we collected qualitatively, because policymakers like numbers in the end. So we, on the basis of resident responses, then used, some of you may know the FAO's FIES scale, so Food Insecurity Experience Scale. So we then retrofitted our evidence onto the scale and came up with the magic number of the percentage of people in our study who had experienced food poverty. And the scale ranges from being worried about running out of food to actually running out of food in various stages in between. And we came up with a magic number of 53%. Now that has to be caveated in so many ways because there are lots of assumptions behind it. But the policymakers loved it, and they ran with it. They took it seriously. I do think it opened eyes. I think they were not aware of the seriousness of the problem in Oxford. So there's been a willingness to listen and recognise a problem. We're working on various policy levers, but it's long-term work, and the people you're talking with are shifting all the time. Yeah, I think that's as much as I can say at this point.
That's really helpful. Any other questions?
Hi, thank you very much for all the presentations. I've got a sort of specific question really for Corinna and Jamie about, I was intrigued by this idea of business tax rate exemptions. I can't remember where it was that the example you provided, Corinna, but I wondered if there are any examples from the UK where that kind of thing has been applied, and perhaps kind of challenges in doing that, or levers to do that. So one of my massive bugbears is the food offer in places where children go, and 90% of places where they are clearly targeting their main audience for young children, the food on offer is the most unhealthy, with a few token healthy things chucked in on the side and sort of hidden away. And I would have thought, obviously, the main reason for that is probably profit. And so a way to target that has got to be, you can't tell organisations that you're going to stop them making profit, but if there's a way that you can give them an exemption to something, so it's more of a carrot than a stick, it just sort of seems a little bit like a no-brainer. And I imagine there's probably not much research on that area, because you've first got to get the buy-in from organisations to be able to do this research, and then to do it robustly, you need controls and you need cluster randomised control trials. They're just, the ability to do that is so challenging. But do you know of any examples? How difficult is it to do that kind of thing?
Jamie might be able to give some examples from London. I think that there's a huge role for these kinds of fiscal levers that are just not being used, and they're being used in the wrong ways. So I don't know any of examples, and others may know from the UK, from the food scene. But we know that charity shops don't have to pay. Oh heavens, I can't remember the exact mechanism, but they are treated. So they don't have to pay business rates. No, so they don't have to pay business rates. If any of you are from not so wealthy towns, you may have seen that charity shops dominate a lot of high streets because they don't have to pay business rates. It's extraordinary. I live in a small town in the east of England, which is a classic kind of high street closing down because it's not a really wealthy town, and it's just charity shops that come in. So that's an example about how not paying business rates just can have a massive incentive for companies to come in. And it's not just my town. I mean, it's a phenomena all over the place. And just imagine if that was applied to food stores. I mean, it's incredible. So I think there's a lot of potential. The other thing is about markets, open markets. Again, if you go to a lot of areas, if you go to a lot of the cities in the north of England that are really run down, the high streets are really run down, they still have markets, fresh fruit markets, selling food for really inexpensive prices that are really important places that people can go to get fruits and vegetables. Are we really incentivising them fiscally? Or are we actually paying for the new out-of-town McDonald's and KFC to come in? Councils are investing massively in these out-of-town leisure centre things that they say are going to be really great, but in fact they just make everybody unhealthy and they create safety risks. So I think, again, councils need to really get to grips with that, but make that happen, we need to have local residents demanding healthy high streets. And it really needs to come from residents. And I just don't think people feel empowered. I think they don't feel they can do anything about it. It's not their business. So there's some bottom-up movement that really needs to happen. But Jamie might have some.
You still get knocked back by councils. You've got to have an awful lot of gumption to just keep going.
Well, that's what I mean. I think it's so difficult. I think it's really difficult, and it drives me bonkers how councils are not more. I mean, there are lots of examples of really great councils doing interesting things, but most of them are not. And but maybe it is the power of what we said about Toronto. Maybe we need some small examples to show that it's possible, and then that can infect the system to show how it can be done. But Jamie, do you know any other examples?
No. It's amazing how little in this country we have devolution of fiscal levers compared to other countries. I think I can't remember the statistics. About 5% of the kind of the income cut is decided locally, and the business rate is a really relevant one to mention because that is a really good lever that City Hall and that local authorities have. We're piloting the devolution of business rates growth, and it's interesting because once it becomes the money that local authorities are looking after, they become very, very cautious about giving those exemptions over to businesses. So we're really trying that out at the moment for different areas and the different social outcomes that property users can have. But it doesn't happen at the moment, no.
Thank you very much. We've actually come to the end of the time for the discussion, and that's flown by. And I don't know about you people, but I certainly feel like I've learned a tremendous amount from the panel discussion today. I think we've learned, we've really learned about the importance of people-centered approaches and some practical strategies in terms of how to do that, as well as sort of hearing from people's direct experience. And we've heard about where things are at in terms of the Oxford food movement and the London food strategy, which I think is fantastic. I have to say I've probably come away with more questions than answers, and I think there's still a long way to go. Like one of the questions I wanted to pose was, how are we going to know whether we've had an impact? And linked to that, I feel that one of the things we're trying to move towards is a healthy and sustainable food environment. But I don't really get a sense of how we're tackling that sustainability side of things through these movements at the moment. So I think we've learned a lot, and there's clearly a lot of good initiatives going on. certainly taking some of this experience back to Sydney and looking at how we can learn from that and use that experience when we get back there. And looking forward to sort of continuing the discussions through the work of the George Institute and in collaboration with other people going forward. So thank you to everybody for coming this evening, this afternoon, evening. It's really been great to have you all here and to join in the discussion. But particularly thank you to the speakers and the panelists. It's been really great. Thanks very much for your time. That's all. Enjoy the drink. So I think the drinks are just through in the atrium. So
we've got a report about lived experience over here and some other things if you want to pick them up.